Welcome. Today we are talking about how to eliminate headaches. So often patients have tried and tried and tried, whether it's over-the-counter medications like Tylenol, migraine medication, ice, heat, essential oils, acupuncture, physical therapy, and even other chiropractors, and yet are still suffering from debilitating headaches. So today I want to share with you what we do here at Corrective Spinal Care of California to help eliminate headaches. The first thing a patient does when they come in is they fill out a brief questionnaire so we can understand a little bit more about them. Then one of our doctors is going to have a consultation where we can sit down and discuss your health history. Let's talk about how long have these headaches have been here. Is it just starting, or maybe it's been going on for some time? Has there been a history of traumas, any surgeries, any medications you've tried, things you've tried? We compile all this information so we have a better understanding of who you are and whether or not we can help. Okay. After the history, we discuss moving forward. If we think we can help, we're going to do some specific testing. So postural tests, chiropractic tests. We're going to do orthopedic neurological examinations. This information is going to greatly help us get closer to understanding the root problem of your headaches. From there, we will typically get a set of pictures, so x-rays, digital x-rays from the front and some digital x-rays from the side. We're going to have those standing so we can see how you're resisting gravity. From that point, we will palpate and feel all 24 vertebrae in your spine. All right, imagine if you had your x-ray goggles on. This is what I'd look like from the front, and this is what I'd look like from the side. So we would palpate and feel all 24 vertebrae so we can get a sense of how things are moving. We then compare that information with the x-rays, with your history in the exam, so that the next visit we can sit down and describe to you exactly what's going on and whether chiropractic can help or not. Now, typically we're going to see a couple things when it comes to headaches. First off, so often I hear patients when they're at work and they're describing, and maybe they're even complaining about the headaches. So often the coworkers have the headaches too, so people assume that headaches are normal. Oh, doc, I don't have any headaches except for those normal ones I wake up with. That's not normal. Headaches are definitely not normal. This is your body's way of telling you, warning, warning, exit the next freeway off-ramp, because what you're doing, where you're going, is that of disease, sickness, and eventually death. You need to pull over and reassess your health. 86% of all headaches, 86% of all headaches come from the top of the neck. So when we palpate and feel the spine, we're looking at these top 7 bones. And the very top one is called the atlas. So the atlas, and you can see here, you can see the red, this is your arteries. So your heart is pumping blood to the brain. And if your atlas is out of its normal position, if it's subluxated, that's going to change the amount of blood that's going into the brain. So the majority of headaches stem from this top of the neck, this atlas being out of its normal position. So the only thing that's going to get that bone back in place is a specific chiropractic adjustment. Depending on how long this problem's been here, it might take days, weeks, months, heck, sometimes even years if the atlas has been subluxated for, let's say, 50, 60 years. So assessing the upper cervical is a crucial ingredient towards getting people away from medications, away from suffering, and removing all headaches. Now, one of the things I can actually remember, my father saying this years ago. My father, some of you may know Dr. Charles Rassel. He was here for 43 years, and I can recall him telling patients when they described to him that they've been having headaches, he would say, "Oh, we don't put up with those around here." And it's true, we don't put up with headaches around here. I mean, if 86% of them are coming from a chiropractic problem, there's a very, very good chance we are going to be able to help you. There's a really good chance that if it's not a chiropractic problem, we're going to guide you to someone that can. Your nutrition has a huge impact on it. We're going to go over in a different video the different kinds of headaches, but we also know that nutrition, stress, all these factors can contribute to these headaches getting worse. But the underlying cause, the underlying problem stems from the very top of the neck. Now remember, your head is big. It's like 10 to 15 pounds. And so when we're looking at someone from the side, the ear should line up with the shoulder. And anytime this 10 to 15 pound bowling ball goes in front of your head, the muscles in the back of the neck and this base of the skull, these suboccipital muscles, they can become tight. One side might pull more than the other, and eventually we might have a subluxation in that region. So in our clinic, we're going to make sure that your head is in its proper position. And to do so, we're checking posture from the outside, but then once again, we're looking at those digital standing x-rays so we can determine exactly where your head is in comparison to the rest of your body, in comparison to your spine. If someone you know is suffering from headaches, if someone you care about has been trying and trying to get rid of them and nothing seems to work with medication, why don't you share this video with them? Why don't you reach out, be that beacon of light, and you never know whose life you might change. You never know what you might think, say, or do today that's going to impact the lives of millions tomorrow. So please share, like, and subscribe. We'll talk again soon. Thank you.